We're back now live, continuing with our special report, Coronavirus Questions Answered, and we're getting in breaking news. We've been monitoring a special meeting by CMS officials for you, and we just learned that they've decided, the CMS School Board, to move spring break up 3 weeks. They just passed this, we understand. School will still be in session on Monday, and then students will be out on Thursday and all of the following week.
So next week, yeah, they go Monday, Tuesday, Wednesday, and then spring break starts for Thursday, Friday, and the following week.
Right. We have a panel of experts here with us tonight. You've been joining us, answering questions. Wanted to get your initial reaction, you know, from the financial aspect, the business aspect, and from our physicians as you're hearing this news right now.
I bet a lot of parents are checking their travel plans and see if they bought travel insurance, because they may be canceling some trips that were planned 3 weeks from now. You better bet they're taking a hard look at all of their daycare options and things, because that's going to be changing here tremendously. I bet most of the parents that have kids, you know, age 12 and under, are just working the phones tonight, figuring out what they're going to do over the next 3 weeks. It's going to be chaos for a lot of people.
Yeah, it's just a dilemma. I mean, people plan vacations, they plan for the whole year about spring break and everything that's going on, and now it's got to spin around on their head now. I mean, even myself personally, my daughter is a teacher, and her birthday is on the spring break day, so we had planned a cruise. We've got a vacation planned for her birthday, so now we got to find out what can we do, or now what?
Did you get travel insurance?
Oh, it doesn't cover that type of sickness.
Right. And to our physicians, we're talking about the announcement from the governor earlier this week saying, you know, limit areas with, you know, 100 or more people. And so this would be for 3 more days of school, you know, next week when children are in these spaces together, and then them taking a break after that. What would you say or weigh in on, you know, some of this decision and how parents can try to make sure we keep our kids safe as we go through this too?
Yeah, it's interesting. You know, I think this virus is going to play out for many weeks, so I'm not sure what impact closing just for a week and a half is going to have on the trajectory. Obviously, minimizing kind of group contact and, you know, the ability to spread viruses in that kind of setting is important, but I'm not sure that closing for a week and a half or just moving spring break up is going to significantly impact the trajectory. They may need to consider lengthening that if that's the way they're going to go.
If I could, I just want to get to another question from a viewer on Facebook here. Emily Schaefer, she wants to know, is it safe to assume that our local hospitals can handle the caseload of COVID-19 patients if this were to get much worse? And we saw even the president asked about that today, someone saying, do we have enough ventilators? That seems quite dire, but and we're going to talk about flattening the curve in a minute to avoid that situation, but how prepared are we if it were to get to that point where thousands of people at once needed hospitalization?
Yeah, I think hospitals are working very hard to make sure they're as prepared as possible. I do think it circles back to the importance of not going to the hospital unless you absolutely need to, because we need to reserve those services for people that are the sickest of the sick, that need the ventilators, that need the specialized care we provide in those centers.
I think the other important thing to really recognize is people that are at higher risk for complications from this virus. We've seen the people that are requiring hospitalization and having very severe disease are those in our older population, particularly those above the age of 65 or 70, and those with chronic medical conditions. And so really taking extra care to protect those people so that we can also limit the impact on our hospitals.
We do have a story from our Joe Bruno. I just want to go and we'll play that story really quick. He talks about flattening the curve and the cancellations. We'll come back and get Mr. Mattier if you want to react to that.
March Madness, the NBA, the NHL, bar crawls, concerts, parades, all of these events canceled. You might be asking yourself why. It all comes back to this phrase, flatten the curve. Here's what it means. Doctors and scientists have come to the conclusion a whole lot of people are likely going to get COVID-19. The goal now is to make sure the hospital system isn't overburdened. Take a look at this graph. On the x-axis here, you have the time since the first case. On the y-axis, you have the number of daily cases. The healthcare system capacity is right here. Without protective measures in place, we could see cases soar, creating this huge spike. All of these coronavirus patients combined with people who need other treatments bogging down a healthcare system. The goal is to stop that spread, but until that happens, the next best thing is to slow it down. By canceling all of these events and practicing social distancing, it helps flatten the curve, spreading out COVID-19 cases, easing the burden of doctors, hospitals, and medical professionals.
And Jay, that is a huge financial impact. And you look at the NBA, these guys are wealthy. All the people whose jobs rely on those leagues, they're suffering.
Yes, they are. For people, the bell curve is with the start of the virus and the projection that it takes to get to a certain peak before it drops off. We come up with a cure, or it just kind of dwindles off itself. What we want to do is get to a point where we're cutting that off, where we're trying to prevent the spread or prevent the rise to the curve and cut it off ahead of time. We are in a good position here in Charlotte because right now we don't have that many infected cases. Now, some important things are, if the bill passes, we've got to get the test kits. We've got to get the test kits in the city so that we can actually, if in fact, have that, if it leads to that, then we'll be able to have the testing. But right now we're in decent shape because it hasn't really spread. I think there's only been one
case in
actual
Mecklenburg,
case, and it's kind of contained. But now it's a race against time and a race against the clock so that we can actually get in position to flatten that curve.
Okay, so again, this is something everyone is taking seriously, and looking at things like going to those screening centers before just showing up at your medical place or doctor's office to get that care. We're going to continue our conversation in just a moment with all of our experts. We'll be right back in a moment.